He continues, when implemented, the Complete Lives system produces a priority curve on which individuals between the ages roughly 15 and 40 get the most substantial chance, little time out again, the most substantial chance of what? This paper is specifically written about the allocation of medical resources in an age of scarce resources, or medical procedures in an age of scarce resources. So who is going to get what when we start to run out of money? So just to go back and reread this, the Complete Lives system produces a priority curve in which individuals between the ages roughly 15 and 40 get the most substantial chance of a medical procedure in the age of scarce resources, where the youngest and the oldest people, well, they get chances that are somewhat attenuated. He goes on. Unlike allocation by sex or race, allocation by age is not discrimination. Treating 65-year-olds differently because of stereotypes, now that would be ageist. And of course we can't be ageist. So he says, but treating them differently because they have already had more life years is not. Again, this is taken from Lancet, January 31st, 2009. This next slide is a graph lifted directly from that paper. On the left is probability of receiving an intervention. On the bottom is the age in years. On the left here, we can see at birth, 0, there is a relatively low chance of receiving a medical procedure. About the age 15, the odds are much higher. So we treat those that between 50 and starts to drop off again about age 55. And then over age 55, the chance of receiving a medical procedure in an age of scarce resources drops off. So as I speak around the country, I ask, how can you cut $500 billion from Medicare? Well, it's right there, right in that rectangle. So it's pretty easy to cut that kind of money. All you do is you take the philosophy of Plato, of Nietzsche, of Singer, and apply it to policy. So who was the director of bioethics? Well, it turns out it's Ezekiel Emanuel, brother of Rahm Emanuel, former White House Chief of Staff, and he was the White House Healthcare Policy Advisor for the development of the Patient Protection and Affordable Care Act. So we see in the Lancet his philosophy, and we've seen that philosophy before. I'll go back and say, with time, the unthinkable becomes thinkable. And with more time, the thinkable becomes accepted. We see this in the writings of Peter Singer, in terms of not considering humans fully human until 28 days of age, the left end of the curve. We also see this in the story of Barbara Wagner, where she was denied chemotherapy and offered physician-assisted suicide by a state-run program that ostensibly was well-intended. Because Oregon had a problem with the rising number of uninsured, so it started the Oregon Health Plan to cover those that didn't have insurance. But then they ran out of money. So we put this in context now of our national debt. Back when the Complete Lives system was introduced in January 2009, the United States had a debt of $10.6 trillion. Since then, it's grown now, I just had to change the slide yesterday, to $15.7 trillion. Our national debt is increased by $5 trillion, over $5 trillion, since this paper was written. Put that in context of just interest on the debt. Right now we're paying about 2.25% interest on our debt, or about $240 billion a year. Historic norms are between 5 and 6%, where we pay between $500 and $600 billion a year. And as this debt explodes, we can easily reach $1 trillion plus just in interest on our national debt. To put this in perspective, in 2010, Medicare cost about $520 billion. Medicaid was about $420 billion. So we're approaching a point in time where interest on our debt is starting to equal what we spend on Medicare and Medicaid. This was a chart that was released by the Senate Budget Committee, Republican staff, where on the left we see the total debt of Europe, and on the right is the debt of the United States. Now the United States debt exceeds that of all of Europe combined. Now, on a per capita basis, we have more debt per individual than that of Europe. And you think of this in context of Portugal and Spain and Greece, and the countries that are so much struggling with debt.